Hello, good afternoon, all of you. I myself Girish Vyas from Dr. Ken Modi University. I assistant professor in pharmacy department. Basically, I'm just today I'm all here to discuss a very important topic which we are very familiarized with antibiotics. So it's for the diploma second year class. What we discuss, we will discuss about the antibiotics. What are the antibiotics? Firstly, secondly, we will discuss about the rings. What are the basic rings and structure of this antibiotics? What are the different classes of antibiotics? We will discuss about the properties, physical or chemical. It could be both. And then we will discuss about the storage of antibiotics. And then we will discuss about the uses, the basic uses for the different kind of antibiotics. So it's my basic topic. So let's come to the point. What are the antibiotics? I think you are more familiarized with the antibiotics. Antibiotics are the agents which are basically used to kill or stop the growth of microorganisms or bacterial infections. So, what are the bacterial infections and what are the microorganisms? The bacterial infections are the infections which are caused by basically by bacteria. And microorganisms, what are the microorganisms? These are the smallest unit of like kind of the bacteria. These are the very smaller size which are in microns. So these are called the microorganisms, and these are the living. So these are called organisms. So what are the antibiotics? Antibiotics are the agents which are basically used to stop the growth of bacteria, microorganisms, or to destroy them. It's all written here. So let's come with me. Antibiotics are the medicines that fight bacterial infections in people and animals. It could be for the human beings or animals also. They work by killing the bacteria or by making it hard for the bacteria to grow and multiply. Basically, for the specific site, specific type of the disease, the antibiotics. Whenever we are giving a medicines or antibiotics to a patient, but these antibiotics shows an effect on specific patient at the specific site. So there is a multiplication of bacteria is get stopped or it is removed with the effect of antibiotics. So it could be taken by orally, it could be given by in IV. So different preparations are available in the market of antibiotics for the different kind of the disease. It could be a lotion, it could be a IV set, intravenous. It could be given by in a tablet form, in a pills form, in a capsule form. These are written here. So I just given a general picture here. It could be a paracetamol, you can call it. But here I am considering these are the kind of antibiotics. Let's come with me. Here I classify antibiotics in different categories. So first category is the sulfonamides are here. Second is the quinolines and fluoroquinolines. Third one is the beta lactam. Fourth one is tetracycline. Then macrolides, and fourth one is the last one is aminoglycosides. So what? Uh, Basically, a bacteria is made up of uh, a single cell. It could be a cell, and cells are made up of a different kind of the amino acid. So there is an effect of CONH bond is there. So basically, the antibiotics works on that CONH group and kills that bacteria and removes us from that infection or their multiple growths. So what we are having sulfonamides here. I just classified in different drugs are here. Just sulfa metajol, sulfa diazine, sulfa metho, trimethoprim, and other categories are there. Basically, sulfa drugs are basically used for the treatment of skin infection or fungal infections or a burn. Quinolines and fluoroquinolines. These are divided into different categories, different generation. So quinolines, I think you are very familiar about this for the infection of the Plasmodium falciparum for the malaria. So you have to go with a complete kit of the quinolines. Yeah, uh, or you have to get injections. Uh, Here is another category of beta lactam tetracycline. Tetracycline should not be given generally, just for the it causes a stain on the leaves, yellow color of the stain. Then macrolides and aminoglycosides. Okay, so I will discuss uh, a single kind of antibiotic. We will start with the basic structure of antibiotic. So it's a here. It's the basic structure of an antibiotic. So what is basic in this? It's the basic. Basic is the beta lactam ring. antibiotic property of this ring is shown in every kind of the antibiotic. Whenever we are talking about especially penicillin. So penicillin is made up of this ring and this ring. Okay, so it's divided into two categories. Second is the cephalosporin and this one is the penicillin. Let me discuss this. So first, this is structure C, nitrogen and oxygen. This is known as the beta lactam ring. And another ring which is closely close with the fuse system. This is known as the thiazolidine ring. Okay, so there is on this position there is COOH group is present, and we are having here the side chain. Side chain means what? Side chain means what? After removing this, after we are not talking about this. If we are having this CORCONA, so this is the side chain. Whenever we change this R or alkyl group, there it could form a new kind of the antibiotic. Okay. So let's come with me. Here I'm showing something else. That is the cephalosporin and this is the penicillin. What is the difference in this? This is the pentacyclic ring and this is the hexacyclic ring. Okay. So beta lactam antibiotics. These are the antibiotics having beta lactam ring. What is the beta lactam? This one is the beta lactam ring. Okay. The two major groups of the penicillins and cephalosporin. Then what is the need to prepare cephalosporin? What is the need of this? Patients who are not responding to the penicillins, they are treated with cephalosporin. So there is a need for the creation of cephalosporin. Is this patient? So there are some kind of the patients who are not respond to penicillin. So they created cephalosporin. Let's come to the next. So I am just here to discuss on benzyl penicillin. So benzyl penicillin is basically known as the penicillin C. What is penicillin C? It's an antibiotic to treat the number of bacterial infections. Bacterial infection, it was also known as the penicillin G, potassium penicillin. It's a marketed preparation here. Okay, so let's talk about the structure of benzyl penicillin. Just it's the complete structure which is same as I discussed earlier, and just what we changed here, the alkyl group, the R group, we changed it with this benzene and CS2. Okay, we changed it with benzene and CS2. And why we call it a benzyl penicillin? Why we call it benzyl penicillin? Just because these carbons are known as the phenylic carbon, and this carbon is known as benzylic carbon. So we call it benzyl and penicillin. Okay, so this is the benzyl and this is the penicillin. So this is completely called a benzyl penicillin. Let's come to the IUPAC name. IUPAC name is the 3,3-dimethyl 7-oxo. On the 6th position, 2-phenyl acetyl amino. On the 4th position, thia 1 asa bicyclo 320 heptane 2 carboxylic acid. It seems too difficult, but it's very easy. Let me tell you. When we start a numbering of this benzyl penicillin, we start from here. Just because of it's a fused ring and it is a centralized atom in this. So we give it 1, 2, 3, 4, 5, 6, 7. Okay. So then let's come to the point. On the 1, 2, 3. On the third position, there are two methyl groups are there. So then we wrote here 3,3-dimethyl. Okay. Let's finish. And then while removing, on the 7th position, there is an oxygen group is there. So then 7 oxo. On the 6th position, there is an amino group, and it is attached with the phenyl. So then 1, 2 phenyl acetyl. Acetyl means this group. Okay. Amino means this group. Amino. 4 thia. 1, 2, 3, 4. Fourth position containing a thia group is there. On the first position, asa bicyclo. On the first position, nitrogen means asa. Bicyclo means these are the two cycles are here. So this is called a bicyclo. 320. Yes, it's very important. 320. What is 320? 3 means what? We are having after removing this ring. We have 1, 2, and 3. 3 substances are here. 1, 2, 3. Dot. 1, 2 are here. Then 2, and we are having nothing in between these two carbons. So it's called a 0. Heptane means what? 7 ring. 1, 2, 3, 4, 5, 6, 7. So it's known as heptane. On the second position, there is a 1, 2 carboxylic acid. So it's a very easier name. So this is the name of benzyl penicillin. So let's talk about some physical and chemical properties of benzyl penicillin. We are having a molecular weight of 334. We can calculate easily with the different molecules present in this. Physical description, it's a solid form, it's an amorphous white powder. The melting point could be of 214 to 217 degrees centigrade. It's a slightly soluble in water. pH could be strength from 5 to 7.5, and it should be stored in the well closed airtight container. Just because of its hygroscopic in nature, it absorbs hydrous substance from the environment, so it's always stored in the airtight containers. Okay, so let's talk about some what in which kind of the infection it is basically used. What used? Benzyl penicillin. In which kind of the infection benzyl penicillin used? There are lots of diseases are there. The first one is the pneumonia. Second one is the strep throat, syphilis, necrotizing enterocolitis, diphtheria, gas gangrene, cellitis, tetanus. These are the very common names which are used to go through with it. So pneumonia is just an air sac. There's a filling of the pus into the air sac. That is known as the pneumonia. Strep throat definitely something bacterial infection in throat. Syphilis means what? It's an bacterial infection used to spread with the sexual STD. It's called STD. So what is diphtheria? It is directly spreading by the Corynebacterium diphtheriae. What is the gas gangrene? Gas gangrene means there is an inability of arms, legs, toes. There is a lack of blood supply, lack of oxygen supply in a specific site or in a specific area. Okay, it's also used as a first line agent for the pneumococcal meningitis. It's a brain kind of disease. We will not discuss it here, but it's just a general introduction about the benzyl penicillin. So let's come to the other penicillin. Just what we did, the complete entire ring is set. Just we changing these are alkyl groups here. So what is the benzene and oxygen here? So what we call it, the internal carbons are known as the phenylic carbon, and this is the oxygen. So it's one phenyl oxygen. So then it's known as phenoxy. And what is this? This is the penicillin. It's a penicillinic acid. So it's completely known as phenoxy penicillin. Okay. What we changed in this ampicillin? We just changed the entire structure is also same. What we changed from the benzyl penicillin as compared when we are comparing the benzyl penicillin and ampicillin, we just changed as hydrogen with NH2 group and it converted into ampicillin. So antibiotics are very easy, and this is a topic is not that much worse. We are used to get depressed with this kind of the topics, but it's just an introduction. We will discuss more in our next classes. If I have made you clear, if you have any query, you can write me on girish.com@dknmu.rg, or you can comment on in the